Hi, everyone, and welcome to a very special episode where Tina is not going to be the host, but is going to be the talent, the guest. My name is Candice Carlton, if I haven't had the opportunity to meet you yet. And I'm going to take on the role of host and interviewer so that you can get all the key insights from what this episode is about, Tina's latest book. Congratulations, Tina. So exciting that you're launching. I know this has been years in the
Thank you
making.
so much.
The Fertility Healing Journey. So I think that this episode is going to be a keystone episode in your podcast. So that if you are someone on a fertility journey or you're part of a couple on a fertility journal, this is probably the episode you're going to listen to as a companion to this newly launched book. So in this episode, we're going to get into the crux of the matter, the key essentials to help guide your learning journey. Anything else you want to say about that, Tina?
Well, first, I just want to thank you, Candice, for this interview. And for those of you that did not hear one of my first episodes, Candice actually interviewed me at the beginning of season 1 of my podcast, just helping me get started. And she was really the inspiration for me to start my podcast. So I just want to give you a shout out and just thank you for being that inspiration and for giving me that gentle push to start my
You're
podcast.
You're so welcome. And so, for anyone that's listening, I am a friend of Tina, a patient of Tina, and then also a strategic marketing consultant in wealth management. And on the side, what I love most, wellness. So, that's why I'm here today. I've got some really keystone questions. And so, the first one is you open the book by telling women you are not broken. Yet, so many of them arrive at your clinic with some deep shame or self blame. What's actually happening in the body when a woman internalizes the belief? And what's the first shift you try to create in someone who walks in feeling that way?
Well, I think sometimes it's not even a conscious level thinking of something's wrong with me or something's broken, but it's very apparent when I meet with patients that there is sort of this overarching feeling of, having been challenged with fertility and not being able to succeed in having a baby using the same strategies that they've used throughout their entire life, whether it's through school, whether it's being an athlete, or just even professionally. And so I think when I meet with patients, and I sense that this is sort of this overarching feeling. One of the things that I always reiterate to patients is that, I just want you to know that you are perfect just the way you are, and you are at the exact point that you're supposed to be at in your fertility journey. And I think oftentimes when patients come to see us, they have already seen other specialists. So they might have seen an OBGYN, a reproductive endocrinologist, an infertility specialist, and they may not have heard the best news, whether it's your labs are looking like your ovarian reserve is declining, you have less eggs than you should for your age. I mean, these are very common, diagnoses or findings that occur for women. And I think it's very disheartening and discouraging for women. And because of the culture, I think, of women today, most of us are very career oriented, at least in Southern California, I should say, that they are going through this trajectory of schooling and career and moving up the corporate ladder, and they're doing amazing things, and they're all like boss ladies, like really just top notch in their career. And so I think by the time they are ready to start a family, maybe they're in their mid 30s or early 40s. That's the first point in their life where they can actually breathe and have some time to really think about starting a family. So that's kind of the traditional, not traditional, but the common pattern of patients that I see, or the common patients that come into my office, are these women in these phases of their life.
It's so interesting because I've had some friends who were on a fertility journal, and the sense that I got from them was a sense that they were kind of like broken and there was something wrong with them. And I was surprised by it. I think what's also really interesting is, as you've articulated, a lot of your patients are high achieving women who've built their
Hmm.
careers by pushing harder when things are difficult. I
That's
identify that.
right.
And then you've written in your book that fertility doesn't respond well to that approach. So, what does surrendering actually look
Hmm.
like in practice for someone who's never operated that way? And how do you help patients tell the difference between giving up and like creating space? Because it's a whole new way of
That
being.
that is a great question. I think I have to go back to the philosophy of Chinese medicine. At the base of Chinese medicine is this philosophy of yin and yang. So in Chinese medicine, yin really represents like quiescence, going with the flow, not pushing. It represents the feminine energy, our blood, our body fluids. Yang, on the other hand, is a little bit more like energized, movement. It represents chi. And when I think about the yin and yang balance, the yang is about pushing through, right? And making things happen. We need yang. The yin is about nourishment, having some quiet time, and allowing you to be in the present moment and create space for you to reflect and for you to heal and reset. So, the way that I think patients, when they come in, when they get a sense of this, wow, I can actually be in a quiet state for 30 minutes during acupuncture, I think they're actually shocked that their body can do that. And so having treatments like acupuncture or even Reiki or cranial sacral therapy or even a very relaxing massage can put you in that surrendered state. But I don't think we're aware of that until we experience that calm state of being. Then we kind of go, oh, this is something that's been missing out of my life. And it's sort of this epiphany, and many women will tell me after their first treatment, this is the most relaxed I've ever been. And so that to me signals that they're definitely pushing through most of the time and that we need to help them remind themselves to take more time to be in the yin space.
Yeah.
So outside of treatment, of course, we usually guide them with things that they can do at home, whether it's guided meditations, yoga, qigong, deep breathing exercises. So there is a plethora of things that they could do on their own too to continue this state of peace and calm and surrender.
So if a woman is just starting her fertility journey today and say she's been trying for 6 months, I don't know what the timeline would be, but what would you have her do in the next 90 days that most people don't think to do until much later? And on the flip side, what's something women commonly do early on that you wish they'd skip?
Oh, those are good questions. Okay. Well, I would say in the beginning of well, wherever you are in the fertility journey, I think that the top things to look at would be your lifestyle. How many hours are you working a day? What type of workouts do you have? How much downtime are you giving yourself? And so, really recognizing what your existing lifestyle is important. I don't ever want to add more on top of what these women are doing because most of them are doing a lot. One of the things that I will say, and now after COVID, it's probably not as prevalent, but I would say looking at travel schedule. In the past, when I was treating women pre-COVID, there was a lot of travel and there was
Mm,
a lot of flying and being in different time zones. And I think that definitely can impact your your cycles, your circadian rhythm. And so I'd say looking at that aspect too. Like if you're a busy executive that's traveling a lot, really trying to kind of stay in your time zone as much as possible would be one
mm,
thing. The second thing is looking at the way you're moving your body. How are you
mm.
exercising? Are you exercising? So are you in a sedentary career where you're sitting a lot? And if so, we want to make sure we get some movement in there, whether it's like walks at lunch, yoga and stretching, maybe incorporating some, other gentle exercises. Like I'm a big fan of more yin type exercises. So yin type exercises to me would be like yoga, Pilates, bar. Yang exercises are more like hit things, running, spinning, um, kickboxing. Those types of things are more yang. Although you don't have to eliminate those completely, it's nice to balance it with more yin activities because in Southern California, women are really fit and active. So most of them are doing a lot of HIIT exercises. They're very lean. And if that's your body type and your lifestyle, think about introducing more yin into your life. Hiking, walking along the beach, yoga, things that just kind of reset your body and calm your nervous system. That's key. The third thing is looking at your diet. What are you putting into your body? What can you change? Are you including a lot of inflammatory triggers into your diet, whether it's alcohol, caffeine, processed sugars, nightshade vegetables? And I have a whole chapter in my book that talks about, anti-inflammatory diet and how that can help your body kind of reset and reduce inflammation and allow it to be more optimal in the way that it works and runs. And plus, your energy will be better when you follow a diet that really supports you.
Yeah.
I think I answered
Yeah, I think
everything.
I think so. What I'm hearing is like it's the opposite of like our Western culture of like pushing, and then from a Chinese medicine perspective, really rebalancing. And it's not about giving up; it's about changing the energy of activities,
Right.
mindset, and then nutrition as well.
Hmm. And, additional things, of course, for our patients when they come to see us would be the addition of herbs,
Mm,
supplements, acupuncture, energy medicine. And I always tell patients, we'll meet you wherever you're at. So don't ever feel like the suggestions and recommendations we give you, you have to do all of it because it can be very
yeah.
overwhelming. And so I always tell patients, we just change one thing at a time and see how you feel. And most patients feel really great and they're like, okay, what's next? Right? So that's sort of like an easy approach to incorporating change. But
It's like a
most
path.
women, yeah, I'm sorry,
Sorry, I
go
was
ahead.
about to say it's almost like a path to feeling better. It's not a path to like pushing more. It's the opposite.
Exactly. Yeah, it's a path to optimal health and wellness,
Mm,
feeling the best version of yourself. And so whether you're trying to have a baby or not, we all owe it to ourselves to feel this way.
mm,
So, and I think we forget, because usually we're kind of pushing through and, you know, a lot of people are workaholics. And I always joke that it's not until we're ready to introduce, a new little one into our lives that we actually reflect and we take better care of ourselves. But it shouldn't have to be that way. We should be doing that for ourselves anyways. But
mm,
unfortunately, that's not always the case, right?
mhm. I love that in your book you spend a full chapter on male fertility,
Hmm.
and you call sperm health one of the most reversible factors in fertility. Yet couples often spend years investigating the woman first. Why does this blind spot persist? And how do you coach a woman to bring her partner into the process without it becoming a source of conflict?
That is a very interesting question. And I will say women are more proactive. So they're always the
Yeah.
first one to say, I want to get some help. And also they're always the first ones to blame themselves.
Mm,
So the way the medical model is set up, there's so much around a women's reproductive system and health. So I think it always starts that way first. And women get the workup first, they get the lab work done, the imaging done that's associated with fertility workup. And, because men, I mean, let's be honest, we usually release 1 to 2 eggs a month
mhm,
naturally. Men have millions of sperm. So there's definitely a quantity advantage. However, there is a quality issue at times. And for some men, if they have any type of anatomical issues, sometimes those things aren't identified right away, whether it's a varicocele or some other maybe like sports trauma that they might have had growing up that can also impact their sperm health as well. And lifestyle things, men are affected by stress as well. And, I don't think, actually, I feel bad for guys because they're kind of ignored in the
mm,
beginning. And most men don't love going to see their providers or their physicians. So I think they kind of shy away from having any type of testing done. But the conversation that I have with most couples, and I always encourage the men to come in for the initial visit too, so we can have like this joint discussion around fertility and starting a family. I always tell them it takes two to make a baby. why not optimize the health and the genetics for your unborn child?
Mm-hmm.
Men are 50% of the equation. Even though men don't carry the babies, the contribution they make on a genetic level is huge. It's half
Huge.
and half. Yeah.
Mm-hmm.
And so men are funny because, they kind of have that competitive nature. So I always say to them, don't you want a genetically superior child? And they're like, yeah. What do I need to do? And so you kind of have to appeal to that level. And
Mm-hmm.
because men aren't the ones carrying the baby for 9 months, I don't really think they understand the weight of their contribution.
Mm-hmm.
So it's really just about education, awareness. And once they're dialed in, men are great. They're committed. They're usually really regimented. They'll follow the diet, they'll take the supplements or herbs, and they'll even come in for treatments too. So, in an ideal situation, I would love to treat both the men and women.
I love that. Um, I think what's really interesting, I think this is one of the most fascinating parts of the book, is your book moves from supplements and lab work, and I want to touch a little bit on the lab work in a
Mhm.
moment, all the way to spirit babies and and the heart uterus channel. For a reader who's drawn to the science but skeptical of the spiritual side, or vice versa, how do
Yeah,
you invite them to consider both without asking them to abandon what they already believe?
I don't think abandonment needs to be in the equation. I think the
Mm-hmm.
only thing that is suggested is just be open to receive and open to listen, because the heart uterus connection in Chinese medicine, so there's what's called channels or meridians that connect all of our organs and tissues, and these channels help to conduct the flow of energy, blood, and vital nutrients to nourish our bodies. And so in Chinese medicine, there's an actual direct channel or link between the heart and uterus. And so you can think of this as an open heart means an open womb or open uterus. So if
Mm-hmm.
that channel is not open, that can actually block or impact fertility. And so when I explain it that way, most patients receive that well. Open heart, open womb. And they
Mm-hmm.
usually say, yes, I want that. And so what opens our heart, right? Love, joy, lack of fear, happiness, doing things that you love to do, being around people that you enjoy. What impacts the heart? What closes down that channel? Fear, anxiety, grief, those all block things. And when you're on this path to motherhood, if you've had challenges, if you've had any type of loss, that can shut down the heart channel, the heart uterus channel right away. And grieving that loss is such a difficult thing that I don't even think we are aware that that block is happening. And I think being very intentional about reopening that connection can really be impactful for these women, because they don't even realize the heaviness that they carry after loss or after disappointment, whether it's a failed IVF cycle or a disappointing diagnosis. So I just think of it, as, or explain it as, find something that brings you joy or go back to doing the things that you loved, whether it's singing, dancing, artwork, because oftentimes when women are on this journey, they are sacrificing everything. There's a lot of no's, can't eat this, can't do this, got to stop this, can't do hot sauna anymore or hot yoga. And so there's kind of this sense of deprivation, like I'm
Mm.
deprived of doing the things I enjoy. So I always encourage patients to just do one thing that they really miss that's still very healthy for them, but allows them to keep that heart open and reconnect.
I love it because it comes back to kind of your opener, which is like, you're not broken, but also there is this acknowledgement if your fertility journey has been challenging. And I think almost all your patients come in having had challenges and losses or frustration. You're not broken. And one of the ways to help you co-create what you want is by stepping more into yin, doing less. And then what I'm hearing is more joy, more of an open heart, more of co-collaboration with your partner, right? And then with your spirit, tell us just a little bit for anyone who's listening and hasn't got to the chapter yet. What is the spirit baby?
Ooh, a spirit baby is the baby that's waiting to come into your life. And
Mm,
spirit babies have different journeys. Some spirit babies come in, touch down for a moment, just to give you the encouragement that you can't get pregnant.
mm,
And unfortunately, some of those spirit babies aren't meant to last. They're just meant to come in for a moment. And I like to think of those babies as angel babies that kind of set the path and give you hope that you can get pregnant. And then other spirit babies might incarnate completely and come earthside, and they're meant
mm,
to be a child. And so I always encourage patients to remember that because I know miscarriages and loss can be so heartbreaking, but to know that these little spirit babies that come in for a reason. And, they're really meant to help you along the path to the next child that's supposed to fully come in. And so when we're working with the spirit baby realm, it's important to communicate with your unborn child and tell them you're ready and you're open to receive them. And, whether patients are open to that or not, all they have to do is just visualize their unborn child and welcome them in to their lives. And that in itself can be so powerful to start that connection. And so I know it sounds like something that's very esoteric, but when you're in this place and you're so ready to welcome your child in, most couples get it. They are very dialed in to the spirit baby connection.
mm.
So, and hopefully listeners and readers will feel this way too.
It's like it feels to me like on an outside, it's like you're helping couples and specifically women begin to really tap into, instead of pushing, their co-creation type potential,
Right.
with,
Right.
yeah, with the universe, with their spirit baby, with creating more space and almost like
Mhm.
what I hear from the more yin balancing activities as a fellow career woman and pusher over here is almost like I think about a garden is creating the conditions for more fertility, but I think about for a more fertile environment,
That's right. Yeah, laying
sunshine.
down the fertile soil, the environment, exactly the sun. That's all needed to grow this healthy plant. And the chapter in my book is called Conscious Creation. So
Mhm.
I love the way you put it because that is exactly it. Having the conscious awareness of what you're doing for yourself as a couple, and also consciously inviting your baby to come into your life and setting that foundation.
Mm. So, uh, fertility care in the US is, I think, very fragmented.
Hmm.
And from my
Hmm.
experience, just as a woman not dealing with fertility, but just health in general, is that we really have to be our own advocates and like integrators. And so, what I love about your book, Tina, is it teaches readers how to bridge specialists who typically don't talk to each other. So, just tell us a
Yes.
little bit about the types of specialists you typically work with in partnership when you're working with a couple or a woman.
So depending on the stage that they're in their fertility journey, usually I'm sometimes the first person they're seeing, which is fantastic, kind of rare, but sometimes. Most of the time, patients have already seen an OBGYN, obstetrician gynecologist. They've done some type of workup, which includes lab work, maybe some imaging like a hysterosalpingogram, an ultrasound. And then other patients might already have started in the assisted reproductive world, and they might be working with a reproductive endocrinologist and infertility doctor. So wherever they are, we can help them. And if they have a workup, it's very helpful because then we get some idea of what's going on. Where are some of the imbalances in their current state, and what can we help them with? With Chinese herbs, with acupuncture, Chinese herbal medicine is very powerful in balancing your cycle. A lot of women have hormonal imbalances in different parts of their cycle that might actually impact their ovulation, their fertilization, as well as the implantation process. So being able to identify sort of those deficiencies in their cycles is really important. And it helps us prescribe not only the herbal formulas and supplements that we use, but also our acupuncture treatment plan in terms of frequency of treatment, timing of frequency. Our job is to really fine tune their treatment plan according to their system and modify it as needed because beautifully, acupuncture can kind of reset, rebalance, and recalibrate things in your body so that eventually your body is able to kind of heal itself or tap into this innate healing mechanism that exists within all of us. So when that innate healing system is activated, balance and homeostasis comes into play. So acupuncture is just a tool to kind of like, okay, we need to reawaken that innate healing system, right? And to get everything in sync again.
I love it. So as you're thinking about your book and you're thinking about your readers and you're thinking about all the people that might have access to it who you may never even work with, or you may, depending
Mm-hmm.
on what is it that you want women or couples to take away? If they took away one thing from your book, what would it be?
Well, that this path to parenthood is such a special path. I think it's a time where you get to reflect on your own health, your own self, and just it's such an empowering time. It's almost like I like to liken it to like a spiritual awakening for yourself,
Mm-hmm.
for not just to your own self, but as a couple, and as well as your connection to your spirit baby that's coming in. And wherever you're at, whether you're just starting or you've been in it for several years, it's never too late. And just trust in the divine timing of this journey for yourself. And I know it's hard because there's a lot of external noises with social media and friends and families and other people whose fertility path might seem a little bit more straightforward and a little easier. But just know that your path is meant to be this way and trust that it is all going to work out in the best possible way and the way it's meant to be. And when patients are working, kind of going back to your question about the practitioners that we work with, even if you're going down the route of IVF, the work that we do here and what other Chinese medicine doctors and acupuncturists do can be so helpful. It doesn't have to be one or the other. It doesn't have to be, okay, now that I'm ready to go into ART, I need to ditch my Chinese medicine. It's not like that at all. We can co-treat, we can collaborate, and I'd say the majority of our patients actually come from OBGYNs and fertility doctors and centers. And most of the time it's because patients either have had an unsuccessful cycle or their hormones, their egg quality is not optimal. So that's when they kind of say, let's pause and go see Dr. Yang and her team. And let's get you to a point where things are more balanced and your maybe your antral follicle count is more abundant and then we can start the cycle. So I just kind of want to give that message to patients that wherever you are, whatever treatments you're getting, just remember collaboration and integration is possible. And if you're working with a provider that does not believe in integration, you may want to get a second opinion because the
Mm-hmm.
majority of the doctors that are progressive and successful are very open to integration with natural medicine, with acupuncture, TCM, functional medicine, naturopathic medicine. So that it has really shifted. When I started 20 years ago, it was very different. Now, majority of my referrals are coming from Western physicians, which I love
Mm-hmm.
and I'm so grateful for.
I love everything about that. Well, Tina, congratulations on this book. Such a milestone. How are you feeling about soon to be releasing it to the world?
Ooh, goodness, a little nervous, a little shy about it because it's really a, a compilation of my work for the last 24 years. And I
Mm-hmm.
really wanted to create a book that was easy to read by patients or potential patients or anyone on this fertility journey. And I wanted to make it more conversational, like what it's like when I meet with my patients and providing tools that these readers can incorporate on their own for self-care, whether it's like incorporating certain supplements. So I really wanted patients to or readers actually to come away with tips that can be applied immediately in their life and to help them along their fertility journey. So
Okay,
go
you're
ahead. Sorry,
excited. I'm
Candice.
like imagining a book signing. I hope that we're going to do an event with some books and book
Yes,
signing.
I am planning to do a virtual launch at the end of June. And the book's probably going to be released mid-June through Amazon, and it'll be available through our website. And then after the virtual launch, we're going to actually have a book signing launch party in person at Revive Chi Health and Fertility Center at my clinic in the mid-July. So that's the plan for now, but stay tuned. I'll have more details ironed out in the upcoming weeks.
And I imagine it could be a book tour, a podcast book tour, maybe like on
I
other
would love that. I haven't thought that far, but yes, that would be amazing.
It's a marketing person in me, I'm telling you.
Okay, Candice,
Oh,
I
well,
will
thanks everyone for
definitely
listening.
connect with you for more guidance on that. Yes.
And if you're someone and you're listening and you'd like Tina to come on your podcast, please reach out. As you can tell, such an expansive, I would say, Tina, perspective, worldview, especially on this topic of integrating everything from lab testing. I know you're so detailed about that, to working collaboration, to thinking about lifestyle, and then even beyond what we talked about, esoteric elements and incorporating that. So really, really beautiful. And at the end of your book, you're going to have some stories of your patients and some photos.
Yes. Yes. That's probably the favorite part of the book for me.
So if you want to imagine yourself at the end of the book, you can take a look at people like you maybe that have come before you for some inspiration.
For sure. Thank you so much, Candice, for this interview. I really appreciate your time and just all your guidance and inspiration.
You're so lovely. Thanks, Tina. And thanks everyone for listening. Go check out the book. And if you can, come to one of the parties, virtual and or in person.
Yes, please.